right. Well, we'll go ahead and get started since it just turned 12 o'clock. Go ahead and start the session. Wanted to let everyone know that thank you for joining us today. We are in our, let's see, this is the Louisiana Provider to Provider Line Pediatric Mental Health Echo. We are in our fifth series of this Pediatric Mental Health Echo. So super excited to have everyone joining us today. I see a lot of familiar faces, but also some new folks joining us. So welcome to our group. I'm going to go over a few housekeeping items before we start today. Just wanted to introduce myself first. My name is Lena Reget, and I'm an LCSW and board approved clinical supervisor, and I'm one of the mental health specialists with PPCL. So I'll be coordinating the ECHO today and just keeping us on time alongside Dr. Olivier, who will be our facilitator. But just wanted to go over our agenda. We keep a tight ship because we want to be respectful of everyone's time. I know it's folks' lunch break, but we will do some introductions and then we will pass it on to our didactic presenter. We have Dr. Blanchard today that's going to present on the ASD diagnostic process. So super excited about her presentation. And then after Dr. Blanchard presents, we will pass it on to the lovely Margaret Smith, who will present a case to us today. And then we'll go through clarifying questions and then kind of discuss as a group and then provide some recommendations for Margaret and her case. And after we do that, we'll wrap up. We'll put the link in the chat for the evaluation and we'll just have a few announcements for next month's session. But before we pass it on and do some introductions, just wanted to go over the host of this ECHO. It's the provider to provider consultation line. And as I said earlier, I'm one of the mental health specialists for PPCL. And we provide no cost mental health support for Louisiana providers across the state. So if you have any questions about pediatric or perinatal mental health and need some support, it can be about resources, it can be to speak to one of our perinatal or pediatric psychiatrists. We also have addiction medicine specialists on contract. So if there's a question about substance use disorder, feel free to give us a call. We're available Monday to Friday, 8 to 4:30, and we also have an online consult request option. So if you'd like to register, if you're not already, just scan that QR code and we'll get you registered. But I will now pass it on to Dr. Olivier to lead us in introductions.
Hey, good afternoon, everybody. I'm Dr. Olivier. I'm a child and adolescent psychiatrist here in Lafayette, Louisiana. I have a private practice called Bloom Mental Wellness. I am the ECHO facilitator for these sessions, so I try and help us run on time and on the clock. Just to remind y'all, in each of these sessions, we have a hub team, we call it. These are a team of providers that represent different specialties that are applicable to our mental health sessions. You met Lena. She's representing our social workers today. I'm representing our psychiatrists. I'll also ask Ashley Hutchins to introduce herself. She's representing our nurses today.
Hi, everybody. I'm Ashley Hutchins. I'm a psychiatric nurse practitioner at Bloom Mental Wellness in Lafayette.
Thanks, Ashley. And also Dr. Queen is representing our pediatricians.
Hey, sorry. I'm having trouble with my. Do I hear it? Is anyone else hear an echo?
There's an echo. Just everyone make sure to mute yourselves if you're not muted. That helps with that.
I have Zoom open 2 times. Anyways, I'm Dr. Queen. I'm a pediatrician, also specialize in obesity medicine with the Lake.
All right, thank you, Dr. Queen. And I'm going to go right into turning this over to Dr. Blanchard. I'll just ask you to introduce yourself to our participants and go ahead with your presentation for autism services. Thank you.
Hi, my name is Hallie Blanchard. I'm a licensed psychologist at Manning Family Children's in New Orleans, working at the Autism Center as a part of the Behavioral Health Center here. And I'm going to be talking about some of the different kind of pathways that we can get for autism diagnosis, because there have been some changes in kind of what's required for reimbursement for services for families. And so as we're kind of adapting to that. There have been some changes in how we're approaching diagnostics as well. So I thought I'd share a little bit about that today. All right, so anytime we're talking about autism diagnosis, I think it's important to start off by kind of talking about the changes in terminology that we've seen over the last few years. So prior to 2013, we were looking at a lot of different kind of categories and names for what we now consider to be autism spectrum disorder. It used to be called autistic disorder or just autism. It was separated out into Asperger's disorder, childhood disintegrative disorder, and then pervasive developmental disorder not otherwise specified. And then since 2013, in new versions of the diagnostic manuals, everything has been kind of collapsed into these two main categories. So there's autism spectrum disorder, which is really whenever we're seeing social differences, plus those things like sensory sensitivities, resistance to change, special interests. And then there's social communication disorder, which is kind of where we're just seeing those social differences without that second half of those sensory interests or behavioral pieces that you can see with autism. We can go to the next one here. So the way that criteria is broken down is into two main categories. So social communication and then restricted and repetitive behaviors. Social communication, I think, is pretty aptly named and captures really those main differences in how people approach different social interactions. Restricted and repetitive behaviors is kind of a catch-all for everything else that falls under autism. So with the social communication part, we can see things like differences in social approach and interactions in children that can look like differences in play or kind of how we're integrating other people into those play routines. We may prefer to play by ourselves or include other people in that play, but it's very directive. So kind of telling others exactly what it is that they should do in those play routines with you. There are differences in nonverbal communication. So things like eye contact, gesture use, and facial expressions are all kind of wrapped up in there. And then development, maintenance, and understanding of relationships. So how we're building friendships, whether we're showing interest in peers or not, and what that interest looks like and how we're approaching those interactions. For the behavioral piece here, what we can see is repetitive movements or speech. So those can be, what you'll hear parents or others describing as stimming sometimes. So any repetitive movements with like hands or rocking back and forth. Sometimes we can see spinning, bouncing. Those can all be, like self-soothing behaviors that can fall into that category. Repetitive speech, you can see certain words or phrases that are used over and over again, or certain like non-word sounds that are repeated. We tend to see some adherence to routines and then some distress whenever those routines change. Things like special interests, so becoming hyper-focused on specific videos, specific toys, and then that interest kind of taking up the majority of one's interests. And then sensory differences. So that can be sensory interests. So really seeking out things like lots of movement, certain textures, things like lights, and then sensory sensitivity. So that can be food selectivity or maybe avoiding like bath time or brushing teeth or some of those more like sensory-based daily living activities. And only 2 of those kind of characteristics are needed for a diagnosis of autism. So generally for social communication, you need those differences in social approach and nonverbal communication and development and maintenance of understanding, but you only need 2 of those little areas from the restricted and repetitive behaviors category there. So whenever we're talking about services for autism, specifically young children in particular, one of the main ones that comes up quite often is applied behavior analysis, or ABA therapy. This is kind of a therapy approach that's designed to promote skill development across kind of a range of different areas. So think about daily living skills, anything that's needed for independent living and functional communication. Some safety awareness skills too can be a part of this. So working with caregivers on preventing things like elopement, so like running from the house, and pieces like that. These services are usually covered through insurance or by private pay. They can be center-based or home-based, sometimes school-based as well, where an ABA provider can come into the school setting to work with individuals one-on-one. And these can be short-term services or longer-term, depending on an individual's goals and support needs. And there are a few different kind of ways that we can approach providing a diagnosis to access services like this, as well as services through like Office for Citizens with Developmental Disabilities and those other big like coordination hubs. We really didn't have a lot of flexibility in what that process could look like for obtaining those diagnoses until there were some updates fairly recently, within the last year or so, to the Medicaid manual here. And so I'll kind of go through some of those changes that we're seeing and how we're kind of adapting our practice to go along with them. So the first major change, which really impacts primary care physicians, is being able to provide a diagnosis based on a score on the MCHAT. So essentially, an MCHAT score that's falling in the high risk range, so 8 or above, and documenting really medical necessity for accessing ABA services, meets those requirements for a comprehensive diagnostic evaluation according to Medicaid now. Now, these cases are your ones that have to be pretty clear and have clear medical necessity for accessing some of these care. So things like significant speech delays, self-injurious behavior, things like elopement that are happening, where we're really showing clear, kind of beyond the shadow of a doubt, need for some services to be provided and then also covered. What that documentation would have to include is clinical history, some direct observations of behavior, so including some of what it is that you're seeing during the appointment that supports the scores on the MCHAT, of valid DSM diagnosis, so making sure to document as autism spectrum disorder rather than one of the previous iterations of that. And then a justification for ABA being medically necessary for the patient. And so that's kind of the first prong approach for this. And it's kind of built along a triage model, depending on the level of risk that it is that you're seeing for patients and that level of medical necessity and support needs. Our approach to kind of the next level of that is a rapid autism diagnostic clinic, which is something that we have been running here at Manning Family Children's for about 1.5 years now. That we worked on a specific template with Louisiana Medicaid for implementation at the hospital for whenever we're seeing those high MCHAT scores documented in a patient's record, but that diagnosis wasn't provided for whatever reason. Maybe there were some hesitancies, the referral ended up in our work queue, and so what we're doing here for those cases, and it's usually children under 5, we're meeting those requirements for a comprehensive diagnostic evaluation according to those kind of updated standards. So getting clinical history, clinical interview, really detailed behavior observations, including adaptive screening when available. So some of those screeners that can be used for like OCDD eligibility and pieces like that. And then providing feedback and recommendations within a 90-minute appointment time. This is very different from kind of how we're approaching cases that require more in-depth differential diagnosis. So oftentimes whenever we're seeing families in our clinic, we're completing an intake appointment and then a separate testing appointment, which includes cognitive measures as well as a structured developmental social measure. And then a third appointment, which is a feedback appointment to go over results of everything. What this does is kind of identifies those cases that would have met that that criteria for Medicaid reimbursement for ABA services, and kind of streamlines them so that we are able to put those families in touch with access to those services as quickly as possible. But those are really the major changes that we've seen and how we've adjusted to some of those. But opened up to questions now.
So, so what does, so when you do that rapid, I'm interested